Hi everyone, I hope you are all going well. My name is Pedro Lopez. I'm a professor here at the University of Caxias do Sul, and today we're going to talk about the potential and the importance of fitness for cancer patients in order to improve survival. I'm here with my guest, Francesco Bettariga, very good friend of mine, researcher, doing PhD at Edith Cowan University about exercise oncology, which is the area of exercise for cancer patients. Thank you so much, Francesco, for being here.
Hi everyone, thank you so much, Pedro. It's a pleasure being here and looking forward to talk about the association between physical fitness and mortality in cancer.
That's great. So, Francesco, tell us more about what is fitness? What is how we can measure fitness? What is the concept of fitness?
Yeah, when we talk about fitness, it's important that we start looking at what is fitness. So we have two main components of fitness. One is muscle strength, and the other one is cardiorespiratory fitness. So when we see muscle strength can be defined like, the strength that we have in our upper and lower limbs and can be measured in different ways. And we will have a look about which kind of types of measurement we can use to assess muscle strength. And on the other end, which is completely opposite to muscle strength, we have cardiorespiratory fitness, which is our ability, to endure to physical capacity, our aerobic fitness when we do some aerobic activities. And we have, of course, different types of measurement to assess the cardiorespiratory fitness of a person or a patient in this case. So when we set this, we can have a look about the relationship of muscle strength and cardiorespiratory fitness with mortality.
That's great. That's very interesting. So when you are referring to muscle strength, we are actually talking about the neuromuscular system, right? The capacity of the neuromuscular system to exert something, right, to perform. And then when you're referring to cardiorespiratory fitness, is more about the lungs, the heart, how they work together to actually perform, right?
Yeah, that's correct. So when we talk about muscle strength, for example, a simple way to measure muscle strength can be a leg press or a chest press. So we can measure the lower or upper limb body. Or we can use the isokinetic dynamometer. We can use the hand grip strength, which is a very simple way to determine strength. So dynamic strength, we have a really broad range of different tests that can be used to assess muscle strength. And as you said, when we talk about cardiorespiratory fitness, it's more about our aerobic capacity. And for example, the most used test is probably a maximal test to measure an output like VO2 max, the maximal oxygen uptake, or some submaximal tests on the cycle ergometer, a treadmill, a step. There are different types of tests validated in the literature that can be used again to measure our aerobic capacity.
That's great. So, Francesco, I heard that you're doing a very, very interesting paper about the actual importance of fitness in cancer patients in terms of survival, right? So, could you explain to us, what was the rationale of this investigation?
Yeah, sure. So the rationale, the research question for this paper was to determine if there is an association between muscle strength and or cardiorespiratory fitness with mortality in patients with cancer. The rationale from this paper came from the fact that we already know that there are really good observational studies measuring muscle strength or cardiorespiratory fitness in healthy subjects or people with other disease, and try to determine if people with higher physical fitness levels have longer survival or lower mortality. It's the same way to say the same thing. So there have been a lot of papers measuring this kind of association for healthy people with cardiovascular disease or other kind of disease, but it is unknown if there is an association between physical fitness and mortality in patients with cancer. So in people that already had cancer, and of course, we know that cancer may, impact life of people and we can have some side effects. And we need to still to determine if there is an association between fitness and mortality in this kind of population.
So the actual rationale of the paper is more about we know that mortality is something that affects, right, a lot of cancer patients. So we know that how long they actually survive is it's pretty sure depending on the type of cancer. And we are actually trying to identify some markers that might be predicting survival, correct?
Yeah, that's correct, because this paper is not an intervention paper, it's just observational. That means that we just see once the level of muscle strength and cardiorespiratory fitness, and we follow up patients, in this case, over their life to see when they come to die, unfortunately. This is really important for cancer because, for example, a few months ago, a really important paper came up regarding the incidence and the mortality of cancer. And for example, in 2022, there were around 10 million of cancer deaths, which is a really huge number worldwide, of course, for any type of cancer. So in order to determine which people are more inclined to have a lower mortality rate, it's really important to determine the physical fitness in our case. That's what we did, and we did for every type of cancer at any stage, which is really important. In this way, we have a really big picture of the situation, the current situation.
So, Francesco, let me ask you something. What is the big thing about fitness, like muscle strength, as you said, cardiorespiratory fitness, as you mentioned, and cancer? Like how these measures, they are connected with cancer?
Yeah, this is really important, Pedro, because we know that exercise oncology is a big field that in the last 20, 30 years dramatically increased in terms of publication and research, because we know that exercise in patients with cancer can provide a wide array of benefits, from a physical point of view, psychological point of view, physiological point of view. Indeed, what we currently think is that the skeletal muscle as a system is an endocrine organ. So when we perform any kind of exercise, can be resistance training, which is more to increase muscle strength, or aerobic activities such as walking or running, that of course they promote more an increase in cardiorespiratory fitness. The skeletal system releases some chemicals, substances that they go around the body in different organs, such as the brain, the heart, the bones, and they promote such a good benefits for these organs. And they are involved in all the body and in the tumor regenesis. What does it mean? That when we perform exercise, we are not only improving our strength or our cardiorespiratory fitness, but potentially we're providing some really good benefits like a medicine for our organs, which is really, really important. This is why potentially exercise is associated with a lower risk of mortality in patients with cancer.
So it's actually trying to understand the mechanism behind it, right? If exercise and physical activity, as we know, is kindly associated with a longer survival, right? Maybe the reason why is because exercise or physical activity can promote good increase in muscle strength and cardiorespiratory fitness. Is it something like this?
Yeah, that's correct. So when we talk about the importance of exercise, because exercise promotes very, very good benefits. We know that if we want to increase our physical fitness, so in this case, muscle strength in our paper, muscle strength or cardiorespiratory fitness, the only way for us to increase this kind of physical fitness measure is to expose patients to exercise. So if we want a person to increase muscle strength, potentially we want to do some resistance training exercise, with dumbbells, with machine or whatever. If we want a person to increase the cardiorespiratory fitness level, we want to expose this person to walking, swimming activities, bicycle, whatever, any kind of aerobic exercise that can promote, the increase in cardiorespiratory fitness. And in doing so, we are increasing the physical fitness of our patients.
So how the study was actually done? What kind of study we are talking here?
Yeah, when we talk about the methodology used for our study, we decided to include the observational studies. What is an observational study? Is a study, like I said, where you measure a physical fitness and you follow up this patient over time to see when they die. So we included this kind of studies, including any measure of muscle strength or cardiorespiratory fitness in adult patients. So any kind of patient with any kind of cancer above 18 years old at any stage. So we included both cancer patients undergoing treatment, such as chemotherapy, as well as cancer survivor, which means people that already completed primary treatment and they are going into the survivorship phase. So these were the population that we recruited.
Awesome. So it's like a systematic review, basically, right? So it's a systematic review where you include observational studies, trying to focus on cancer patients, any kind of patient, any kind of stage, and any kind of measure for muscle strength and cardiorespiratory fitness. So it looks very complete.
Yeah, it's a really wide picture of the current situation for cancer patients and the association with physical fitness.
And what about the measures, like the most common measures in the sample, like regarding the muscle strength and regarding the cardiorespiratory fitness? What you found there?
Yeah, what we found is that most of the studies, or I would say all the studies, measure muscle strength using the hand grip, which is a really simple and time effective and cost effective way to measure muscle strength. It's a really simple way. You just hold this grip and you push as much as you can, and this will give you a number in kilograms or pound, whatever. So this was done for muscle strength. For cardiorespiratory fitness, I have to say that half of the study used a submaximal test, such as the 6-minute walking test. You just need to walk for 6 minutes, and you just measure the distance you can cover. Of course, higher the distance, of course, better. The good thing is that this study provides us some really good measure that you can use in everyday clinical practice, such as the hand grip and the 6-minute walking test. Really, really useful for clinicians.
It's really good to hear that, because our health professionals, when they are working in clinical practice, when they are doing the clinics, we need to find measures that might facilitate the way they see the patient, the way they measure the patient, the way they can use this information in a valuable way, how they can use this actual different measures that are simple and can help them predict maybe a very important outcome, a very important clinical endpoint, right? What were the main findings of this study?
So yes, we were impressed because the results are really interesting, because what we found is that patients with higher muscle strength or cardiorespiratory fitness levels compared to people with lower muscle strength or cardiorespiratory fitness level had around 40% reduced risk of mortality. And when we talk about these 40%, it's a really big numbers. And interesting, we included at the end around 47,000 cancer patients, and with any kind of cancer. So we had breast cancer, prostate, lung, and also some less known cancer types, such as head and neck, lymphoma, and other type of cancer. And also, we included at the end any type of stage, like I said, so, very early stage and advanced cancer stage. And so the results gave us like 40% reduced risk of mortality, which is a really interesting finding.
That is a lot. I don't remember right now any treatment giving you that superiority, right? Giving you like that much increase in survival. It's very rare to see like some treatment doing that. Is this like increase in survival consistent across all the cancer types, or consistent across all the stages of cancer? Did you find something about maybe some kind of moderation in terms of cancer stage and cancer type in this population that you investigated?
Yeah, in regard to cancer type, what we found is that the results were similar. So we tried to, it's called subgroup analysis. So we tried to put some cancer types together. So for example, the cancer type for the digestive system, colorectal, stomach cancers, and we split analysis for example, lung cancer or other cancer, and results were similar. So what the message is that if you have higher levels of physical fitness for any type of cancer, you will have a reduced risk of mortality. But I think that the most interesting finding of the subgroup analysis was the fact that patients in an advanced stage of cancer, such as metastatic cancer, had this reduced risk of mortality if they presented with higher muscle strength or cardiorespiratory fitness, which is really interesting considering, that these people are in advanced stage. So we are basically extending their life, which is really, really important.
And I have to say, when the patient is presenting already with an advanced stage, right? When they are presenting with metastatic disease and other comorbidities associated, any kind of increase is very important, right? Any kind of increase in survival, something that we can make them live more and longer and maybe with more quality, it's pretty critical, right? So, wow, I'm very surprised and very excited about the results. Francesco, everything you said looks very important, very engaging, very interesting for us. For us, we are seeing cancer patients, for us who are working in an oncology department, something like that. For us that will probably see cancer patients in our clinical practice. So that's very interesting. Let me ask you, from your point of view, what is the main message of this? What is the main message that you can give to us regarding the results you just spoke about it?
From a practical point of view, the main message is if you are dealing with cancer patients, and we want to increase their survival and we want to expose them to longer survival and lower mortality risk, we should try to increase their physical fitness. So we need to increase muscle strength and or cardiorespiratory fitness. No one is better. They are both good. So if we're dealing with a cancer patient and we try to increase their physical fitness through specific exercise prescription, potentially we are reducing their mortality risk, which is really important for them.
So basically, although this is still an observational study, right, that we are measuring the association of muscle strength and cardiorespiratory fitness with survival, at the end, the message is more about how we can give another step, how we can move forward from that. If we can see that muscle strength, cardiorespiratory fitness are associated with longer survival, the idea now is to actually see if some intervention that can increase muscle strength and cardiorespiratory fitness can actually improve survival as well.
Yeah, that's correct. That's, I think, is the last piece of the jigsaw. So we know that exercise provides big benefits for cancer patients. And we know from observational studies that strength and cardiorespiratory fitness are associated with lower mortality risk. So if we try to create an intervention that, for example, can long for 2 years, 1 year doing exercise and measuring if these people doing exercise will live longer, potentially we are saying that there is a strong association or a strong cause effect between exercise and mortality. Of course, this is difficult to be done because we need to follow patients for years and expose them to a training over the time in a consistent way. So it's not something easy to do from a research point of view, but I think will be the last piece that potentially will be covered in the next decade or so in research. And this will be huge because then we can say that exercise actually really extend or reduce the mortality.
That's a great presentation. I'm really excited about the results. I'm looking forward to see your paper published online, and then I'm sure that everyone here in the university will be looking forward to read it. So in the name of the University of Caxias do Sul, I'm here to say thank you so much for your time and for giving us so much interesting information. So thank you so much, Francesco. I really appreciate it.
Thank you, Pedro. Thank you, everyone. It has been a big pleasure to being here today. So I really enjoyed. Thank you so much.